What's up? Welcome to my YouTube channel. In this video we are talking about thyroid gland. The topics covered in this session are given here. First we will talk about the introduction of thyroid gland. Then we will go to the situation and the dimension of thyroid gland. Then we will talk about the parts of thyroid gland in relation to various parts. Then we will end this topic by discussing the blood supply and the nerve supply. Without further delay, let us start. Now let us come to the introduction part. What do we mean by thyroid gland? Thyroid gland, it is an endocrine gland of our body situated in the neck. It has highly vascular supply and it is required for basal metabolic rate, for maintenance of basal metabolic rate in our body, and the regulation of metabolism of carbohydrate, proteins and fats. Now we come to what is the dimension of thyroid gland. Remember, the thyroid gland has the dimension of 5 centimeter, 2.5 and 2.5 centimeter. What do we mean by this? That it has 5 centimeter of length, 2.5 centimeter of breadth and 2.5 centimeter of width. Okay. Now what is the situation and extent of thyroid gland? Now remember, in order to know this, we can have to look at the adjacent diagram. First, the situation that it is present in the neck region. Yes, it is self-explanatory. I don't need to explain this. But what is the exact position? So you know that the thyroid gland has mainly two structures. First, the lobes. You see there are two lobes, and each of the lobes, they are connected by one isthmus. In our later slides we will discuss that each lobe has one apex and the bases and surfaces, but you see that each lobe, it extends from the middle of the thyroid cartilage to the 4th to 5th tracheal ring. We know that after the thyroid cartilage we are having the trachea, and the trachea is lined by an cartilaginous skeleton, and this cartilaginous skeleton is in the form of incomplete cartilaginous link. So approximately at this level you are having 4th to 5th cartilaginous ring. Okay, this is in terms of the cartilaginous rings and the thyroid cartilage. Now we come to the extent in terms of the vertebral level. So what will be the extent? Remember that it starts from C5, fifth cervical vertebra, to T1, that is first thoracic vertebra. It is the overall extent of the thyroid gland. And what will be the extent of the isthmus if we want to know? Then the extent of the isthmus is basically 2nd to 4th tracheal rings. So in this way we have covered the extent and situation of thyroid gland. Let us revise it in brief. Okay, in terms of thyroid cartilage and the cartilaginous ring, it extends from the middle of the thyroid cartilage to 4th to 5th tracheal ring, the isthmus from 2nd to 4th tracheal rings, and in terms of vertebrae it extends from C5 to T1 vertebrae. Okay, and you remember one thing, that for females, yes, for females the thyroid gland, its size is greater than males. Yes, okay. Now we come to the capsules of thyroid gland. Remember that the thyroid gland, it has two capsules. What are the capsules? First, true capsule, and second one, it is the false capsule. Now the true capsule, it is formed by the peripheral condensation of its deep connective tissue. Yes, On the other hand, false capsule, it is formed by the condensation of the pretracheal layer of deep cervical fascia. Always remember that this true capsule, it is highly adherent to the thyroid gland. On the other hand, the false capsule, it is not adherent. That is why what happens that during thyroidectomy, that is the removal of the thyroid gland, we remove the true capsule along with the thyroid gland, but not the false capsule. Yes. Now we come to the real parts and relations of thyroid gland. Always remember that thyroid gland has one apex, one base, it has three surfaces, and it has two borders. Now in order to visualize this, let us draw a very schematic diagram of thyroid gland. I already said that the thyroid gland has each, here the relations, the parts and relations that I am mentioning, it is for each lobe. We know that thyroid gland has two lobes, and these two lobes, they are joined together with the help of one isthmus. Yes. Now each lobe has one apex, one base, three surfaces, and two borders. Let us draw one lobe in that aspect. Yes. Here this is the schematic diagram of one lobe of thyroid gland. Now you see that each lobe has one apex, it has one base. Now it has three surfaces. What are the three surfaces? First, the surface that I am demarcating with pink color, it is the medial surface. Yes, the surface which I am demarcating with blue color, this is the lateral surface. And the surfaces which I am demarcating with the red color, which you can see, it is I think that this surface with red color, this is the posterolateral surface. Yes. So what are the surfaces? The medial surface one, the lateral surface, and the posterolateral surface. Now we come to the borders. What are the two borders? We have the anterior and the posterior border. Let us see that the border that I am going to draw with this black color, this one, you see this one, this border. Yes, this border separates the medial surface from the lateral surface. This is the anterior border. Which border? This is the anterior border. And there is another border, this one, which separates the lateral surface from the posterolateral surface. Yes, this is the posterior border, or you can say these are the posterior margins. Yes, in this way we have seen, or we have completed the schematic diagram of parts and parts of the thyroid gland, the apex, the base, the surfaces and borders. This is suppose this is for left thyroid lobe, and the same will be applied for the right thyroid lobe also. Both of them they are connected with the help of isthmus. Yes. After discussing the parts, now we come to the relations of thyroid gland. So remember that the apex and base, both of them, they are related to one artery and one nerve, both of them, but they are different. So the apex is related to superior thyroid artery. On the other hand, base is related to inferior thyroid artery. On the other hand, which nerve I am talking about? Apex is related to external laryngeal nerve. On the other hand, base is related to recurrent laryngeal nerve. And we know that external laryngeal nerve, it is a branch of superior laryngeal nerve, and both the superior and recurrent laryngeal nerve, they are the branches of vagus nerve. Yes, vagus nerve means cranial nerve, 10th cranial nerve. Now we come to the surfaces and borders. Let us come to the relations of the surfaces. We know that it has three surfaces. We already discussed. We have the medial, lateral and the posterolateral surface. Basically, we are talking about the medial and the lateral surfaces. Okay. Now, in order to go to the theory part, let us have a look to one diagram. You see, this is a transverse section of thyroid gland. Here you can clearly visualize that this is the medial surface. On the other hand, this one, it is the lateral surface. Yes, and this and it is the posterolateral surface. Here the pink color region, this is the posterolateral surface. Now let us go to the medial and the lateral surface. First, the medial surface. Always remember that the medial surface, it is related with two tubes. What are the two tubes? This is the trachea and esophagus. Medial surface is related to two tubes, trachea and esophagus. It is related to two nerves. What are the two nerves? This is the recurrent laryngeal nerve, and from the superior side or superiorly we are having the this is the recurrent laryngeal, and from the superior side we are having the superior. Yes, we are having the external laryngeal nerve, which is still a branch of superior laryngeal nerve. Okay, so two nerves we are discussing, recurrent laryngeal and the external laryngeal nerve. Two tubes, trachea and esophagus, related to the medial surface of thyroid gland. Now we come to the structures related to the lateral surface of thyroid gland. Here you see that the structures related to lateral surface, they are mainly the muscles. And what are the muscles? Yes, they are mainly the superior belly of omohyoid muscle. Yes, we are having the sternothyroid muscle. Yes, we are having the sternocleidomastoid muscle, and along with it we are having the sternohyoid muscle. So these are the four muscles basically we actually discuss in relation to the lateral surface of thyroid gland. What are they? Sternohyoid, we are having the superior belly of omohyoid, we are having the sternothyroid muscle, and we are having the sternocleidomastoid muscle. Yes, again have a look at this diagram also. Here in this diagram we can clearly see the nerves, the recurrent laryngeal nerve and the superior laryngeal nerve, which gives rise to external laryngeal nerve and its relation to the thyroid gland. Yes, you see that from the above, the vagus nerve, it mainly gives rise to this. What is this? This is the superior laryngeal nerve. This superior laryngeal nerve gives rise to this internal branch, which is the internal laryngeal nerve, and this is the external branch, which is the external laryngeal nerve. And this external laryngeal nerve supplies one muscle, which is the cricothyroid muscle. Yes, and this cricothyroid muscle, you always remember one thing, it is the only muscle of larynx which is supplied by external laryngeal nerve. On the other hand, the remaining all the muscles of larynx, they are supplied by recurrent laryngeal nerve. We know that recurrent laryngeal nerve, they are the paired nerves. We have right and left recurrent laryngeal nerve, which is a branch of yes, which is again a branch of the vagus nerve. This is the recurrent laryngeal nerve. Why they are called recurrent laryngeal nerve? You see that the recurrent means it is the opposite, it is the opposite direction. The superior and external laryngeal nerve, they are actually where they are present from the above, yes, but you can see that this recurrent laryngeal nerve, the recurrent laryngeal nerve here, this recurrent laryngeal nerve, it will come from the below and it actually loops, it will form one loop at the arch of aorta, yes, at the arch of aorta, and hence the term recurrent we use this. Similarly, in this diagram also you are having the external branch of superior laryngeal nerve which supplies the cricothyroid muscle, and similarly you are having the recurrent laryngeal nerve. Here you can see that this is the recurrent laryngeal nerve, it loops over it. Okay, so in this way we have completed the relations of the thyroid gland as well. Now we are coming to the arterial supply and blood supply and the nerve supply of thyroid gland. Okay, first the arterial supply of thyroid gland. So always remember that the thyroid gland, it is supplied mainly by two arteries. What are they? Superior thyroid artery and inferior thyroid artery. Now the superior thyroid artery, it is a branch of external carotid artery, and this external carotid artery, it is again a branch of common carotid artery. We have right and left common carotid artery which gives rise to right and left superior thyroid artery, yes, and in an inferior thyroid artery, it is again a branch of thyrocervical trunk, which is a branch of subclavian artery. We have right and left subclavian artery which gives rise to right and left thyrocervical trunk, and it gives rise to right and left inferior thyroid artery. Now in this diagram also it is self-explanatory. Here you see that this is, yes, this is the inferior thyroid artery. This inferior thyroid artery, it mainly arises from this left subclavian artery branch. Yes, this left subclavian artery, it gives rise to left thyrocervical trunk, and from it this inferior thyroid artery arises. Now comes to the superior thyroid artery. You see here that we are having mainly, this is the superior thyroid artery, yes, the superior thyroid artery, I already say in my previous slide, it is related to the apex of each lobe, and this superior thyroid artery, it arises from, yes, this is the external carotid artery, this is the common carotid artery, this is external carotid artery, and from this external carotid artery we are having this superior thyroid artery into the venous drainage. You see that the thyroid gland, it is supplied by three veins. First it is the superior thyroid vein, middle thyroid vein, and inferior thyroid vein. Now you always remember that the superior thyroid vein and the middle thyroid vein, they drain into the, yes, they drain into the superior, they drain into, okay, now we come to the venous drainage. You see that in this diagram you are having this vein, yes, this is the internal jugular vein, yes, and this is what, this is the brachiocephalic trunk, yes, we are having the not brachiocephalic trunk, brachiocephalic vein, and this is the internal jugular vein, and we are talking about here what, the left part. So this is left internal jugular vein and left brachiocephalic vein. Now you come to the venous drainage. Suppose this is the, sorry, this is the thyroid gland we are talking about. Yes, so the thyroid gland has one apex, one middle part, and one lower part. So the upper pole, middle pole, and the lower pole, they are supplied by the corresponding veins. That is the superior thyroid vein, the middle thyroid vein, and the inferior thyroid vein. Now you see that the superior and the middle thyroid vein, yes, they drain, both of them, they drain into the internal jugular vein. Both of them, they drain into the internal jugular vein. Yes, here you see this is the internal jugular vein we are talking about. And the inferior thyroid vein, they will drain into the brachiocephalic vein. Okay, again we know one thing, that this internal jugular vein, they again in turn drain into this brachiocephalic vein. So let us revise it, that the superior and the middle thyroid vein, they drain into internal jugular vein, which in turn drains into brachiocephalic vein. On the other hand, the inferior thyroid vein, they directly drain into the brachiocephalic vein. Okay, now we come to the nerve supply. Always remember that the thyroid gland, it receives nerve supply from superior, middle, and inferior cervical ganglion. Yes, and we know they are mainly vasoconstrictor in nature. Yes, so in this way we have completed today's discussion about thyroid gland. Let us have a quick revision what we have discussed. We firstly come to the introduction part, then we come to the situation and extent, then the dimensions. Okay, then the parts and relations, we have discussed it with the help of diagrams. Then the arterial, venous drainage, and the nerve supply. The arterial supply and the venous drainage, we know that arterial supply, we are having superior and inferior thyroid artery. For venous drainage, we are having superior, middle, and inferior thyroid vein. Nerve supply by the superior, middle, and inferior cervical ganglion. Yes, so if you like my work, then please do like, share, and subscribe to my channel. Thank you very much. And